Hi, I'm Steve Adubato. Welcome to another compelling, important, and relevant program. And we kick off with our longtime and good friend, Michellene Davis, who has a new title. She is the president and CEO of National Medical Fellowships. Good to see you, Michellene.
Great to be here, Steve.
Tell everyone what the National Medical Fellowships is all about and why it matters now more than ever.
Oh, my goodness. Thank you for the question. So National Medical Fellowships is actually one of the first diversity organization in the country's history. It is an organization that really seeks to forward progress the number of Black and Brown physicians in healthcare. More than that, we are looking to ensure that they're going into healthcare leadership now. It's more important than ever because, as we have seen, the structural inequities that lie in this society have really presented unique vulnerabilities for our communities. And so what we know, what science has told us, what evidence has presented is the fact that healthcare disparities are actually pushed back as a result of having more Black and Brown physicians, in particular of those of high cultural competence. And so that is why NMF is here, in order to ensure that communities are healthy and well long after tomorrow.
But the National Medical Fellowships, it's a foundation, correct?
Correct.
Okay. It provides dollars to whom and for what?
So National Medical Fellowships has provided over the last 75 years over $40 million to over 32,000 alumni. So our alumni are individuals who have been in medical school and are from non-traditional backgrounds, meaning those individuals of color who are from underrepresented communities in medicine. And it is the exact reason and why we actually see so many minority physicians right now practicing in medicine, and it is the investment that we need for the future.
The impact of COVID, we've had so many conversations over the years, not only about the inequities that you talked about, but social determinants of health, which still remains a core to who you are and what you do every day. How has the COVID epidemic, as we tape on the 20th of July, just before we got on the air, we're talking about the Delta variant, who knows? Here's the question. To what degree has it impacted, exacerbated, you use whatever word you want to use, the work of your foundation?
Well, I will tell you, it has made it more relevant than ever before. You know, we already know about the historical inequities that have really created and what wound up being the perfect storm of society in order for COVID-19 to really ravage the most vulnerable communities. However, one of the things that folks are missing is the fact that of the 3,600 healthcare workers who were wiped out as a result of COVID in a report released in April of 2021, 2/3 of them were Black and Brown. So not only are we not as prominently in the profession as we need in order to push back against healthcare disparities prior to the pandemic, but as a result of the pandemic, we literally have lost an entire generation of healthcare clinicians that we had gained. It is exactly the reason why I came to National Medical Fellowships. It is because simply issuing a statement or ensuring that there's a celebration of Juneteenth, while incredibly important, is not enough. I really had to make certain that I was rolling up my sleeves and pushing forward the needle on health equity. And that, my friend, is exactly what National Medical Fellowships has been doing quietly for 75 years. It is time for us to be a hidden figure no more.
To what degree can the foundation and the physicians that you are training for today and beyond impact the degree of vaccine resistance that exists right now and moving forward in Black and Brown communities that is also just as devastating?
Steve, I love that you asked the question. It's evidence that A, you've done your homework, and B, you certainly get it. You know that the hesitancy—
Trying to get it.
You get it, my friend. And what's most important, you haven't given up on trying to get it, right? So incredibly important. You know that hesitancy is actually as a result of a variety of things, but chief among them has been the earned, I think it's really important that we acknowledge that, right? The well-earned level of high distrust of the medical community from communities of color. That is because of the forced exploitation and experimentation and sterilization of certain groups in society. Chief among them have been Africans displaced in America and utilized, as in the study of obstetrics and gynecology, we know that African women who were enslaved were experimented on time and time again without anesthesia as Dr. Marion Sims developed the science of obstetrics and gynecology, and then he went off to his white counterparts and utilized anesthesia and performed these surgeries in their home after they had been perfected on individuals who were intentionally infected oftentimes. We know about Tuskegee, we know about Henrietta Lacks, but most people sometimes forget that many of these issues, many of these abject sterilization efforts were taking place up to and through the 1970s, right? So it's really keenly important that
sponsored by the government.
Sponsored by the government, my friend, and sanctioned by medicine. Let us be clear here, right? We owe an entire segment of society an incredible apology that they have yet to truly receive. And when I say that, I mean not a verbal apology. I mean apology that is reflected in the way in which healthcare is literally developed and distributed and presented to them, right? Have we in fact ensured that we haven't just wrung our hands and said, yeah, that's really bad, we haven't actually achieved health equity? Or are we ensuring that every clinical, administrative, and operational decision goes through a racial equity assessment in order to assess whether or not we are reinforcing historical structural inequity, historical structural racism? And until that happens, we are going to continue having this. But what evidence has shown us is the fact that we know Black babies live longer when they have Black doctors, point blank, period, right? This is what the studies have said. Don't be mad at me. This is literally what the evidence has portrayed, indicating Black women live longer. We keep talking about maternal mortality. You know, woe is us, right? And because of the fact that we continue down a path where we haven't actually bettered the outcomes of maternal mortality in this state in the last 30 years. However, what we also know is that evidence has shown us that Black women tend to live longer when they have Black doctors. So why are we not having more investment in ensuring the pipeline of Black doctors? That, my friend, is what NMF actually does. When you talk about the vaccine hesitancy, it causes me to have to talk about our fantastic partnerships with the Janssen Department of J&J.
Johnson & Johnson.
Yeah, absolutely. And with their new announcement of our partnership with Bristol Myers Squibb Foundation, where literally they have given us an opportunity with a $100 million grant to really increase cultural competency in clinical trials, but also to community center the voice, right, of that community that we're going to be treating and working with through ensuring that we are including a curriculum that hastens the pipeline of physicians, researchers, and investigators of color. This is so incredibly important, my friend, in order to ensure that we are being able to say to the communities who are hesitant that, listen, not only are we taking that into account, but that we've had individuals from your community around the table when we were literally going through the clinical trial and developing the vaccine.
Yeah, by the way, diversity in those trials is critically important, creating greater public awareness. Michellene Davis has not lost any of the passion, the conviction she has for the work she's doing every day. She's also, we are honored to have her as a trustee of our board at the Caucus Educational Corporation. Hey, Michellene, we'll have many conversations offline and on air. Thank you so much, my friend.
Thank you.
I'm Steve Adubato. Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, Investors Bank, Horizon Blue Cross Blue Shield of New Jersey, Summit Health, the Robert Wood Johnson Foundation, Johnson & Johnson, the Healthcare Foundation of New Jersey, United Airlines, and by the Adler Aphasia Center. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by CIANJ and Commerce Magazine.
Hi, I'm Governor Tom Kean. A dear friend of mine had aphasia, which is a language disorder that occurs from a brain injury or a stroke. It robs a person's ability to communicate, but it doesn't affect their intellect. Programs and services offered at the Adler Aphasia Center help to improve my friend's communication skills. as well as her self-confidence and quality of life. Most importantly, she was among people who understood her. If you or a loved one has been diagnosed with aphasia, there is hope.